How are you doing today?
Doing well. How about yourself?
Great, thank you. My name is Cynthia and I'm going to be your practitioner today.
Okay.
Can you tell me your name, full name?
Jesse Casella,
Your date of birth?
9487,
And today's date?
August 4th, 2018.
Okay, and what brings you in today?
Physical.
Okay. Alrighty, so I'm going to go ahead and start the physical exam and then I'll just be letting you know what I'm going to be doing before with any of the testing, okay?
Sounds good.
So I'm going to start with first inspecting your head, hair, scalp. Okay, take a look at your nails. Okay, I'm going to be looking at your conjunctiva and your sclera. Okay. Alrighty, can you go ahead and I'm going to be testing cranial nerve number 7. Can you smile for me? Big smile, a frown, and stick out your tongue. Okay. Alrighty, now I'm going to be testing cranial nerve number 5. So you're just going to tell me if you feel sharp and then dull. Okay, so first you're going to do it with your eyes closed and then I'm going to tell you what it feels like. So close your eyes and then just give me your hand. And then this is sharp here and
Okay.
this is dull. So you're going to tell me what you feel, okay?
Yes. Sharp. Dull.
Okay, perfect. Okay, now we're going to go ahead and move on to the visual exam. And the Snellen test was 2020, and the vitals are all within normal limits. Okay, so first we're going to go ahead and check the light reflex. Okay. So you just look at my finger here. Okay, perfect. Now you're just going to go ahead and continue to look at me here, and then, or just follow my finger, but don't move your head from side to side. Okay, perfect. Now we're going to go ahead and look at me. Now look at the back of the wall. Now look at my finger again. Okay, perfect. Now we're going to go ahead and do the cover test. We're going to go ahead and do the cover test now. So you're going to go ahead and cover here and continue to look at my finger here. Okay, now bring it back down. Put it back up. Bring it back down. Now do the same for the other eye. Back down, back up, back down. Okay, now you're going to go ahead and cover your eye, right eye. Okay, and I'm going to cover my eye and you're going to tell me when you see my fingers come in your periphery, okay, or when you could see my fingers.
Yeah.
Okay.
No. 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 No.
Okay, now I would go ahead and do the same thing for the other side. Okay, now I would just do the other side, and that was normal as well. Okay, now I'm going to go ahead and be moving on to your ears. So I'll take a look at your ears here. Okay. This is where I would look more closely inside of the ears and the tympanic membrane. Okay. Alrighty. Now I'm going to go ahead and do the whisper test. So I'm going to whisper 2 words and then you're going to tell me what words I whisper to you. Okay, so just go ahead and look forward.
Apple.
Okay, I'm going to do this on the other side.
Football.
Okay, perfect. Now we're going to go ahead and do more with the hearing. So I'm going to put this on the top of your head and it's just going to feel, you're going to tell me where you feel the vibration. It's not going to hurt. Where do you hear that?
Both sides.
Okay, perfect. Now I'm going to put it to the back of your ear and then I'm going to bring, you let me know when you stop feeling it, hearing it, and then I'll bring it up to the front and you let me know when you stop hearing that.
There. There.
Okay, and the time that was longer. So, okay, so now we're going to go ahead and move on to the nose. So I'm going to go ahead and look at your nose. This, I would look closely inside of the nose. now we're going to go ahead and move to the mouth. Can you say ah for me? Okay, say ah. Okay, now put your tongue up. Alrighty, now I'm going to go ahead and get my gloves. And my gauze here. Okay, now I'm going to put this on your tongue here, and I'm just going to move it from side to side, okay? Now stick your tongue out. Okay, okay, here. Now I'm going to palpate inside, so see if any lesions here. Okay, now stick out your tongue. Okay, now gag reflex is present, and I just inspected the tonsils as well. Okay, so now we're going to move on to the sinuses. Okay, you check your any pain?
No.
Okay, now go ahead and feel your temporal artery here. Okay. Can you go ahead and clench? Okay, now open, close. Okay, any pain?
No.
Okay, now I'm going to go ahead and feel for the lymph nodes now. The frontal, back here, occipital over here. Back up. Okay, now the anterior cervical, posterior cervical. Okay, now I'm going to go ahead and feel for the thyroid. You swallow for me. Okay, perfect. Now I'm going to go ahead and listen to the carotid and listen for any bruise. Okay, I'm present. Okay, now we're going to be testing your neck and your strength. So if you can go ahead and put your head from to your chin to your chest.
Mm-hmm.
Now bring your head back, side to side. Okay, can you shrug your shoulders? Okay, now go ahead and press against my hand. Okay. Okay, now shrug against me. Okay, alrighty. Now we're going to go ahead and be moving on to the respiratory exam. So I'll go ahead and examine, front. Go ahead, if you can turn a little bit to the side for me. Okay, then notice 1 to 2 here. Okay, so we're going to go ahead and listen now. You could turn to the side for me just a little bit more. Okay. Breathe in through your mouth. Just normal breaths. Okay, now take a deep breath in. Any pain there?
No.
Okay, do it one more time. Okay, now I'm going to go ahead and percuss here. Okay, now you're going to go ahead and take a deep breath in and then deep breath out. And just leave it, hold it out. Okay. Now you're going to take another deep breath in. Okay, perfect. Now I'm going to go ahead and measure that. 1 second. Okay, and that was 3 centimeters. Okay, now we're going to go ahead and do the, put your hands, stay the same, sorry.
Oh.
And if you could just keep your hands in front of you, put them up please, and then just, or I'm sorry, right in front of you, not, yeah, perfect. Okay. Now you're going to go ahead and say E.
E.
And continue to say E.
E. E. E. E. E. E. E.
Okay. Now you're going to go ahead and say, have the same 99. Just continue to say, repeat 99.
99. 99. 99. 99. 99. 99.
Okay, perfect. Now I'm going to go ahead and check for CVA tenderness. That hurt?
No.
Any pain? Any
No.
discomfort?
No.
Alrighty, now I'm going to go ahead and listen to the front. Lift your arm, please. This arm over here. Okay, now we're going to go ahead and move over to the cardio exam. So if you could just, or you could just stay seated for now. Okay, now I'm going to go ahead and inspect any keys. No, now I'm going to go ahead. Okay, go ahead and listen. Listen with the other side. Okay, now if you could just lean forward for me. Okay, perfect. Now if you could just lay flat for me, please.
On my back?
On your back. Okay, now I'm going to do the same thing and listen again. Okay, if you could lay on your left side for me. Okay, and on this one I'm going to listen to your apical pulse, which is on the 5th midclavicular line. I'm going to listen to that for about 60 seconds. and located the apical pulse and listen for 60 seconds at the fifth intercostal space midclavicular line. Okay, now if you could just lay flat on your back again for me. Okay, and there's no jugular vein distension, and he would be positioned with the head of the bed of 30 to 45 degrees. Okay, so now we're going to go ahead and move on to the abdomen physical part of the exam. So first I'm just going to inspect. No scars, lesions. Okay. Alrighty, so now I'm going to move on to listening. All your questions. Okay, now I'm going to go ahead and listen for any bruise. Okay, now I'm going to go ahead and percuss your liver. Okay. Okay, and that's about 5.5. Okay, now I'm going to do the same side over here for your spleen. Okay, now I'm going to go ahead and palpate, and you just let me know if you feel any pain. Do you feel anything on the right side?
No.
Okay, Rosvine is negative. How about now? Do you feel
No.
anything? Okay. Alrighty, so now we're going to move on, and we're going to do, let's see, lift your leg up, and bring it back down against me, okay. Other leg, up, down. Now bend your knee, and bring it up, and straighten, back down. Same thing with the other side. Okay, back down. Alrighty, any pain there?
No.
Okay, now we're going to go ahead and deeply palpate. Okay, now I'm checking your right kidney. Okay, can you take a deep breath for me? Deep. Okay. Any pain there?
No.
Okay. Alrighty. So now we're going to go ahead, bring your leg up again, and inwards, outwards. Any pain there?
No.
Same thing here, and okay. Now we're going to do the Varus test here. Now I'm going to bring it in. Does that hurt?
No.
Can I bring it out?
No.
Okay. Now we'll do the same for the other side for the valgus and varus test, and that's negative there. Now go ahead and lift your neck. Any pain there?
No.
So negative for the Babinski test. Alrighty, so now we're going to move on to the upper extremity, so you could go ahead and sit up. Okay, and now we're going to move on to the upper extremities test. Okay, so you're just going to close your eyes, and you're going to tell me where you feel me touching you.
Okay. My left cheek. Left knee. Right knee. My right tricep.
Okay, alrighty, now we're going to move on to your fingers. If you can put your fingers out like this, spread them apart, bring back together. Alrighty. Any pain there?
No.
Okay, now can you bring your wrist up, down, side, and then rotate for me. Okay, now can you bring your hands up and go against my hands? Okay, alrighty. Now I'm going to go ahead and hit here. Any pain?
No.
We'll go on this side here. Any
No.
pain there? Okay, so now you're going to go with your wrist. We're going to hold that for about 60 seconds. Okay, and that was for 60 seconds. Any pain there?
No.
Okay, can you lift your arms up for me? All the way up. Okay, now to the side. Now can you bring them back? Can you scratch your back? Okay. Any pain there?
No.
Okay, can you lift your arms up again against me? Okay, now you're gonna go bring your arms in like this, bring them out, bring them back in. Okay, now go against me. Perfect, now go try to open. Okay, perfect. So now we're gonna move on to, I'm gonna feel your lymph nodes here. Feel your, okay, let me do the same on the other side. Okay, now we're gonna move on to the reflexes. I'll just get my now we're going to do a reflex here. Just relax. Okay. Just relax for me. Okay, so other side. Okay, we'll do the triceps here. Just relax. Okay, that was here. Just relax, bend your arm for me. Relax. Alrighty. Okay, so now we're going to move on to the lower extremities and testing that. Okay, so if you can just, let me see, I'm going to put my hands on your knees. Let's see, inspect your knees. Here, I'm going to inspect your ankles, feet. Okay, now can you lift your legs up for me? Bring them back down.